mucinous and myxomatous degeneration. Mucin is glycoprotein secreted by mucus secreting cells زي respiratory tract والGIT. Exaggerated production of mucin may occur either in connective tissue or epithelial cells. الميوسين تحت العين بيكون pale gray transparent slimy fluid. تحت الميكروسكوب بيكون pale blue with hematoxylin. Sites. أول واحد اللي هو الابيثيليال أو الميوكويد degeneration as in catheteral inflammation and mucoid adenocarcinoma. التاني اللي هو الكونكتيف تيشو أو الميكسوميتس degeneration يكون موجود في السبكوتينيوس تيشو الميكسوما ميكسوديما and connective tissue tumors. بيبان تحت الميكروسكوب على شكل few star shaped cells separated by pale blue mucin و hyperchromatic nuclei. السيتوبلازم بيكون بيل. Hyalinosis. Hyalinosis means the deposition of glassy, homogeneous, structureless, eosinophilic protein substance either inside cells or in connective tissue material. Cellular hyalinosis زي المولاري هيالين in liver of chronic alcoholics أو الكوربورا أماليشيا in prostate of old males والراسل bodies in plasma cells in rhinoscleroma. بعد كده الكونكتيف تيشو هيالينوزس يكون في الوول اوف بلاد فيسلز in benign hypertension وفي الأولد سكارز الثرومباي والتيومرز.
Amyloidosis. Amyloidosis is a condition in which there is a deposition of abnormal protein extracellular fibril protein in many tissue, as in kidney. Amyloid, not single substance, but a group of substances that share common physical structure with a fibril protein or biochemical composition. By hematoxin staining under light microscopy, amyloid appear as extracellular, homogeneous, structureless, and eosinophilic hyaline material. It stains positive with congruent. Physical and chemical nature of amyloid. The basis of morphology and physical characteristic. All forms of amyloid are similar in appearance, but they are chemically heterogeneous. Amyloid is composed of two main types of complex protein. First one is fibril protein, which is about 59% of amyloid. This protein can categorize it as under first amyloid light chain, amyloid associated, and other proteins. The other component, which is non-fibril component, which is about 5 to 10% of amyloid structure, and it's constant in all types of amyloid, either amyloid light chain, amyloid associated. It is a constant type, and it's responsible for stability and staining properties of amyloid. Classification of amyloidosis. First, we are going to talk about systemic amyloidosis. Then we are going to talk about localized. First, systemic amyloidosis. Primary systemic amyloid light chain amyloidosis. This type, there is a amyloid light chain fibril protein, generalized in distribution. About 13% causes of amyloid have some from plasma dyscrasias. Most commonly, multiple myeloma in about 10% of causes, and less often, monoclonal gammopathies. The remaining 70% causes of amyloid light chain amyloid do not have evidence, and you are called idiopathic. Secondary or reactive amyloid-associated systemic amyloidosis. This type reactive to inflammation, in which the fibril protein containing amyloid-associated amyloid. It is secondary or reactive amyloidosis, which occur typically as a complication of Complication of what? Complication of chronic infection, non-infectious chronic inflammatory condition associated with tissue destruction, some tumors, familial Mediterranean fever. Third, hemodialysis associated amyloidosis, B2 microglobulin amyloidosis. Patient on long-term dialysis for more than 10 years for chronic renal failure might develop systemic amyloidosis derived from beta-2 microglobulin. The normal kidney can excrete beta-2 microglobulin, but on the dialysis machine it cannot excrete the beta-2 microglobulin, and over years it deposits in the tissue and cause the problems. Fourth, familial amyloidosis. We have two types. First, hereditary polyneuropathic amyloidosis. It is an autosomal dominant disorder in which amyloid is deposited in peripheral and autonomic nervous, resulting in a muscular weakness, pain, paresthesia, or might have a cardiomyopathy. This type of amyloidosis derived from transthyretin amyloid. Second, amyloid in familial Mediterranean fever. It is an autosomal recessive disease, and we are talking about it in the amyloid associated. In the previous slides, we were talking about generalized amyloidosis. Now we are going to talk about localized amyloidosis. First, senile cardiac amyloidosis. Senile cardiac amyloidosis is seen in 50% of people above the age of 70 years. The deposits are seen in the heart and the aorta. Second, senile